Hello everyone, my name is Chelsea Duli. Today I'll be talking to Mr. Nehemiah Latolla. How are you?
Hello Chelsea. Good, thanks yourself.
I'm good. Okay, so first question is, tell me a little bit about yourself.
Well, I am a Ph.D, a doctorate in chemistry, where I look at phytochemistry of plants, which is basically just the chemistry of plants, but specifically those plants used traditionally for the treatment of diabetes and cancer, and trying to find better ways using our indigenous knowledge systems to cure the scourge that we have. Other than that, I'm a fun-loving, passionate young man
Nice.
who enjoys science engagement.
Of course. And why did you choose to study chemistry?
I chose to study chemistry because growing up, every Saturday morning we would have this ritual at home where we'd get this very bitter mixture of aloe vera and magnesium salt, and we call it Epsom salt, and you drink it every Saturday morning without fail, and that had great health benefits to us. It was practices when we were sick. Someone used to go to the back of the garden to go and get something and give, and I was just so fascinated by that process of that we had a whole pharmacy at the back of our garden. And so when I grew up, it wasn't missed on me, that experience, and I wanted to know more about it, so that's why I became a chemist.
So did you decide at a young age that you were going to study chemistry?
Well, I always wanted to help people. I come from a home of missionaries where fundamentally it was instilled in us the need to help your fellow man. And I think I always wanted to do that. My sister became a nurse first, and I saw blood and I was like, it's not my path. And I decided that I would contribute in a different way. And that way for me was to drug discovery, chemistry, and that's why I am.
I see. And another question is, what are the first steps that we can take? I heard that you spoke about decolonizing science.
Okay.
So question is, what are the first steps that we can take to start decolonizing science?
Well, decolonizing science can be a quite taboo topic in certain spaces, decolonization in general, but I find that it's just asking to be taught what you know, which is simple, right?
Yeah.
We are asking, take this knowledge that you are taking from somewhere else. It is present here within our midst. It's ingrained in our indigenous knowledge systems. I mean, Africa is some of the oldest civilizations, or life began in Africa. So surely there are powerful systems that exist that have been passed down. And all it is to relate that to the global conversations around science and bring that to students. And what we find that when you do that exchange, you create a more powerful type of learning, because you create a type of learning that speaks to the heart of the person other than their mind.
Of course. My next question is, can you just talk about phytochemistry of indigenous medical plants in layman terms, and how has it contributed to the management of diabetes?
Wow, phytochemistry as a whole is what you see in our pharmacies right now. Phytochemistry is the study of plants and looking specifically at their chemistry. And as we know, all our drugs from aspirin, which for Disprin, which is in paracetamol, and Panado derivatives, all of those medications came from a bark of a tree. Right, and so all of these medicines that we have, the majority of them, about 60% of the pharmaceuticals that we have, is either from a natural product, which includes plants, living organisms, or it is derived from something found in a plant or a living organism. So that is really the breadth and length of what that is. Yeah.
Also, looking at traditional medicines, a lot of our traditional healers use traditional medicine, and with traditional medicine, it takes some time for it to get to testing to labs so that it can be approved. Why do you think that process is slow, and then what can we do to make sure that people consider traditional and appreciate our traditional medicine?
A large part of my work is to engage with communities to try and demystify the demonization of our indigenous medicinal practices. And some of our indigenous medicinal practices are ingrained in traditional medicinal practitioners and traditional healers that use these. And so I think it's a mindset change that we need to change in people, to say that it is no different than going to a doctor. It's the same thing, it's just a different approach. It is a different, comes from a different cultural approach. And with the issue of validating these, there's really a slow move with validating of what is referred to as alternative medicines. And this, of course, we know has political implications, bureaucratic implications, where pharmaceutical companies aren't really interested in that because they can't make money from it, right? Yes. And so really there are researchers in pockets of researchers, research being conducted in institutions where people are validating this. They're doing it in rat models, they're doing it in cell models. Some people have even been able to do it in clinical trials, and this knowledge is out there. And so what I would say is we possibly need some social scientists to come and do a repository of all of the known information. There's so much we know about plants that are around us and what they are good for, that I think it's not a question about when, but it's a question of how do we make the information available to people, right?
And even during COVID, a lot of people start looking at indigenous plants and medicine. Do you think that we can still continue looking at those type of medicines with other diseases as well?
Yes, of course. In my research group alone, hosted by Dr. Gqeberha at the Nelson Mandela University, we look at all manner of disease with natural products, with plants. We look at diabetes, my interest. I also look at cancer with some of our students that we have. We look at HIV. We look at a disease called schistosomiasis, if I pronounce it correctly, but it's a parasite found in water. So there's various applications for this. And so, of course, in COVID-19, we had the breakthrough with Artemisia afra-umhlonyane. I don't know by what it's known in other spaces, but there was a breakthrough with that. And so definitely I say, let's go back to our gardens and let's go find more to add. You know?
Of course. Next question is, you have traveled in various countries recently, and what is their perspective in terms of indigenous medicine compared to Africa?
Well, traveling in different countries, you realize that it's not something taboo. They are teaching what they know. They are not teaching information from outside, which is so different comparatively to us. So they are busy engaging in practices that is known to their context, that is familiar to them. They are not really trying to answer questions out there, except for maybe if we talk about climate change and sustainability. But people in my field of research are generally looking at things I'm looking at, from Romania to the UK. They are looking at what's happening in their back gardens, what their grandmothers and grandfathers have been doing to aid in this idea or topic of plant chemistry or medicinal chemistry.
It's interesting. Last question is, how would you like to further contribute to general chemistry and organic chemistry?
Ooh, those are pretty set topics. General chemistry. But I would want to contribute my knowledge. I would want to contribute the knowledge of African people, the knowledge of South African people, you know, and what they have to offer, because it is so, the breadth and the vastness of it is so incredibly dense and so rich, you know, that it has potential to change the world.
Of course, definitely. Yes. Dr. Latolla, that's all the questions that I have for you. Thank you so much for your time. Really appreciate it.
Thank you for having me.
How many was it?
It is 2 eyes.
I didn't see it.
So when your brain goes here, right? At the bottom here, right?